We know that even if younger people aren't likely to get super sick with COVID, protecting younger people, vaccinating those who are old enough to get vaccinated, protects the more vulnerable in our community, prevents widespread spread of the virus. So it's concerning to see the disparity among which teenagers in Denver are getting the vaccine. Our Anusha Roy explains how this is not a new issue or one that's just about the COVID vaccine.
The city of Denver shows the highest number of 12 to 17-year-olds who received at least one dose of the COVID vaccine are white teens. That number cuts in half for Hispanic and Latino teens and then dips to around 40% for Black and Asian Pacific Islander teens. This is also part of the age group doctors have been worried about.
We have seen an uptick in COVID patients, but fortunately most of them do not need hospitalization. And I think that's because of their immune system as well as their resilience to some of the COVID variants. But we've also seen the other side of that spectrum. We've seen very sick kids, and unfortunately we've seen a few pass away from COVID.
And while we're talking COVID now, Dr. Washington with Rocky Mountain Hospital for Children said he's seen these kind of stats before.
It's actually mimics what we see in normal vaccinations, measles, mumps, rubella, and those types of vaccinations. There's a disparity there as well.
The issues are the same, no matter which sickness you're talking about. Not understanding the scientific process, bad information, a lack of diversity among healthcare workers.
If you don't have a medical home where you feel safe, you feel like they trust you, you feel like they're in tune with your individual need, you're not likely to access the healthcare system unless you're really sick.
The community that we're serving purposely, the majority don't have access to health insurance. They don't have a regular doctor.
But Maria Gonzalez, the founder of Adelante Community Development, said once you reach the teens, the story starts to change.
What I'm seeing at the flea market, a lot of the younger generations that are getting the vaccine, they're actually happy and encouraging. Some of them are actually convincing their fathers to come and get vaccinated themselves.
So that one organization has been able to vaccinate 10,000 people since February just by meeting people where they were going to spend their day anyway. And they're going to keep doing that for the next couple of weeks. I do, Kyle, always like to give a little perspective on these numbers. The city says they know that some of the numbers are a little bit wonky because they're using multiple sets of data. But they also said while it's not perfect, they do feel really confident that it's giving them the big picture of what's happening with vaccine rates.
But the disparities exist for sure, and there are people out there working hard to break through 100%. One by one. Thank you, Anusha.